Okay, great. Thank you. Well, and I'd like to thank Stephen for giving an opportunity to go a little bit into more depth of our presentation today. And just as a preface, before we go to our slideshow, I'm actually going to present several different sections to give you more of a expanded perspective on what we're doing with our work. And the first thing I'm going to be talking about is the whole concept of longevity and aging in general. Like, why is this important? Because we have a growing population in the United States and worldwide. And I want to give you a little bit of a perspective on that. And then also, we're going to talk about cranial sacral therapy. What is it, if you haven't heard about it, and how that works. And some of the basis of our own research and other research that complements what we're doing. Our model, and some of the results that we found, and then ways that people can get involved. So that's kind of basically an overview of what we'll be doing today. And technically here, I am going to go first into screen share and look at our presentation. And then just a moment here before we convert over to our large screen. And make one other adjustment here. Okay. So hopefully everyone will be able to see that screen. Very good. So, yeah, I entitled this presentation, Cranial Sacral Therapy, the Missing Piece to Alzheimer's Care, because there are many, many modalities which are very complementary to what we're doing. And you've seen a lot of them in the presentations in this particular summit. But I'm going to speak on how cranial sacral therapy as the missing piece helps augment and improve on the results that we've seen with other modalities that have been presented here at this summit as well. So the first thing I want to do is just give everyone a little bit of a perspective on longevity and aging, kind of a national and international perspective. And part of my mission, if you will, that I created because I've been doing this for the last 15 or 20 years is to significantly reduce the deaths worldwide in the next 5 years. And I know that seems like a pretty ambitious goal. What I mean by significant is even if we could make a difference in 20% of the deaths in Alzheimer's over time, that to me would be significant. So an audacious goal, but I think something achievable with some of the training that we can make available. And we'll go more into the details of that in just a moment. So how will we accomplish this? First of all, let me just come back to this screen just for a second. What we're doing is looking at what is available in terms of resources. UpLedger Institute, and I'm an instructor for the UpLedger Institute for the last 20 plus years. We have affiliates in over 57 countries now, even actually more than that. And we have a training program where we can reach people, not just in person with therapists in many different countries, but also online, as we're doing now virtually. We have found since COVID ways to reach people, as I think many of you have, in ways that weren't even possible before. So we're very, very excited about reaching out with this. Even though this is a hands-on therapy with touch, we can train people even at a distance to reach a much greater portion of the population. All right. So again, as I said in the introduction, I've been instructor for the UpLedger Institute for the last 20 years, and I have had the perspective in teaching around the world of seeing that even cross-culturally around the world, this modality works no matter where you are and no matter what the language is. So that's been very, very gratifying to see what's possible in that regard. And as we mentioned, I've been fortunate enough to help coordinate research, both formally and informally, on cranial sacral therapy in this period of time as well. So, opportunities and challenges. Why cranial sacral therapy for seniors? We could say, if we define seniors, if you don't mind me, as anyone over 60 years, Right now, it means that in the United States, there's over 100 million people in the US that are 50 years plus. So that's almost a third of the population. So that's fairly significant. And when I spoke at American Society of Aging last month in Atlanta, Ken Duckwald, who was one of the keynote speakers, mentioned that really when you look at the percentage of people by 2030 that will be 65 or over, we're looking at 1 out of 5 people. So we're looking at 20% of the US population. This is a fairly significant figure. And that's not even including those that are between 50 and 65, which is an important segment of the population we like to protect as well. And as I mentioned, now here's another little piece of the demographic. 70 million people, the baby boomers, will transition into what we call elderhood in the next 15 years. So a lot of you have heard this term, the silver tsunami, and it's like a bubble of time. Ken Duckwald is one of the people that created AgeWave that talks about this. It's like tracking how the baby boomer population, I'm part of that, is transforming every single age that it's transitioned and lived through in over this period of time. So that's pretty significant in terms of what we're anticipating and what we're seeing. About 10,000 people a day turn 65 right now in the US. And elderhood, which is an interesting term, if anyone's ever heard Bill Thomas, he defined elderhood as a state beyond middle age, which has its own characteristics, where beyond material gain and with the attributes of wisdom. And it's the idea, which you really think of it as a resource, that we have elders who are people that have been middle-aged, and now they're thinking of, without having to be focused on work and doing so much, they can actually be the resource for many, many more people for just being elder. And think of a population where older people were really consulted in terms of wisdom itself. So that's exciting to reframe and think of what aging brings to us in terms of a possibility. That's the screen a little more here. Good. And so, and again, as I said, these boomers have transformed every age and the time they've worked through, and in their wake, they're going to redefine what aging means and how we think about it. And they will redefine not only how we think about aging, but how we live as we age, how we think about dying, which is a whole nother conversation, how we treat the diseases of aging. I'm going to talk more about that in a minute. The transition from medical intervention to adjunctive intervention, the way we talk about cranial sacral therapy is that it's not just alternative, but adjunctive. So it means that we should be able to, chapter and verse, speak with anyone who's in the medical professions, and they can understand exactly what we're doing and what structures in the body that we're impacting. And this will also define family, relationships, community, and the world. And again, this is another point which is interesting to consider. This will also define how we approach legacy. And this generation may have a key influence on the outcomes and quality of life on the planet, and how we approach even multi-generational issues. Another concept that Ken Duckwald mentioned in American Society of Aging is that typically we think of, and we can think about this now, 3 generations. And a lot of us in our family, you know, we can pinpoint 3 generations. But he's saying that the way aging is increasing lifespan, or lifespan is increasing, that the lifespan maybe, there's lots of people now, there's a growing group of centenarians, people that are 100 years or more. We can even think of 120 as being an end stage, if you want to think of it, of life. And so we're seeing the possibility that there could be 6 generations. And think about that for a minute. Like, how do we manage, and are we ready as a culture to think about 6 generations? How can we approach that? It's a whole new way of thinking that, you know, this is the first time maybe on the planet that we've ever thought about 6 generations being alive at the same time. So very interesting to think about that, just as a whole nother point of conversation. And cranial sacral therapists, we feel, can play a key role in helping to shape the direction of time and the outcomes of senior care. So, having said that, let's talk a little bit about the way we have thought and define aging in the first place. And there's two ways to think about aging. One is chronological age, and one is biological age. So, as my friends overseas say, chronological age, we can think of that as our passport age, or that's our official recorded age. And biological age, we can define that as how old our body is based on history and lifestyle and our medical history and genetics. So if you've ever seen somebody, you might say, wow, you look a lot younger than, your official chronological age. And that's because their biological age is maybe 5, 10, even 20 years younger, sometimes even more. And then some people, though, you might see them and you might not say it, but they look a lot older than they are. And that's because their biological age is older. And what we want to do, our whole approach with cranial sacral therapy and otherwise is to say, if there's more buffer between our chronological age and our biological age, and we have more reserve in our body, so to speak, that's going to be much more beneficial. So that's the way we think about that in terms of aging and what might the possibility be. So, and then we talk about cranial sacral therapy. How can this assist in the aging process? And how do we define aging? It's all of those factors I just said, what we can do to give ourselves more buffer so we can have a more vibrant quality of life. It's that quality of prevention that we're talking about. And so when we look at aging from a more traditional point of view, and that is indeed changing very, very much in terms of the way that we're looking about aging and longevity. There's a lot of research, even in the last few years, that's changing our construct and format about that. But traditionally, we can think about aging and the way we characterize it in the following ways. One is that one concept is cellular aging, that based on what we have in the body, that cellular aging really defines, almost in a sense, how there's a set construct for aging and there's a set amount of what we have. And once we use it up, that's it. So that's the concept of cellular aging. Now, another concept is random damage, which I love to speak about. And random damage means that in the cellular structure, that something can impact the body, all those bumps and bruises in life, and that can accumulate. So that's another concept we think about when we talk about aging. And another is called cross-linkage or connective tissue damage, that in the body, it's like if you look at someone times and they're older, they look a little bent over like that, aging. That's because the connective tissue structure in the body and the myofascial structure in the body is actually kind of being sucked in and it's consolidating. And so that's a way to think about connective tissue damage. That doesn't necessarily have to be the case, but that might be a factor. And finally, there's something called allostatic load, and that's our recovery from stress. So what we mean by that is that if a stressor comes to us and we can recover fairly quickly, that means we have, in a sense, more resiliency in our nervous system. But some people, if they have an impact, it's so impactful to their physiology that it takes them longer to recover. So in a way to think about allostatic load, and especially that relates to the endocrine system, it's how quickly we can bounce back from any kind of a stress. And it also is a reflection as we get older as to how flexible we are in terms of maybe looking at new ideas, new concepts, new situations. So that's all a function. And I think this is fascinating as a measure, allostatic load. So when we talk, and these are all factors that I just mentioned that have to do with normal aging itself. These are like what we could say are constructs having to do with normal aging. Now, pathological aging, which accelerates aging even above and beyond the normal frame, is that one of the factors are what are called cellular mitochondria degradation. Cellular mitochondria are like the little switch engines inside the cells, and they basically provide energy to our body. And if the mitochondria aren't lively, it means that we simply don't have the energy to function well. So that's a key measure, and people are talking more and more about the mitochondria aspect of our genome itself in our body. And another, which is very, very big, I'll talk even more about in a minute, are called inflammatory mechanisms. And it's the idea if there's inflammation in the body in any way, shape, or form, that's going to affect the quality of our life as well. And then another is called telomeres axis. Researchers at the University of San Francisco years ago, Blackburn won a Nobel Prize in the research on this. And it's the idea that telomeres are like little end caps, like you have a tennis shoe and you have those little plastic end caps on the end. The telomeres are something that are replicated, and they allow the genome and the DNA and RNA transcription to be faithfully passed on daily and weekly and monthly and annually. And if they falter in some way, there seems to be some correlation between telomeres axis and the vibrancy we have in terms of longevity. And a lot of people are really defining even new tests to look at telomeres and see how they can be a reflection of the aging as a major. So that's also a reflection of pathological aging or acceleration of the aging process. So again, and then another thing over and above that is what accelerates the aging process. And we can say one thing is stress, and another thing as a sub-aspect of that is inflammation. So inflammation and immune system challenges. And this used to be something, there's a term being used now, it's called infla-aging. Infla-aging, it means that as we get older, there's more and more inflammation, or that can be a concomitant measure. But it can be, and this is a growing area of concern in terms of health, is that in characteristics of the aging process, even in our 30s, 40s, and 50s, before any memory problems occur, as we're starting to talk about the concept of Alzheimer's, we're kind of building this concept to talk about it, inflammation can show and reflect itself even long before we enter our 60s, 70s, or 80s. And one of the concepts I speak about in my book, Prevent Alzheimer's in Just 10 Minutes a Day, is what I call the pyramid of inflammation. If you look at this pyramid at the base, there's diet and pre-existing conditions. There's about 100 million people in the United States that are diabetic or pre-diabetic, again, about a third of the population. About 20 million roughly that have cardiovascular disease. And then Alzheimer's dementia is at the top of this pyramid, 5 million, really about 5.2 million. And it's interesting if you go to the base, as you go from the pyramid and the peak all the way down, you go down in age. So Alzheimer's dementia, we classically say we're looking at 60s, 70s, 80s, although that's shifting and getting younger. But cardiovascular, we're looking at even 50s, even 40s. Diabetes, pre-diabetics, that could be even into the 20s. So as you go down the pyramid, we're going even younger in terms of measures of age. And if you look at this for a minute and look at this pyramid, what does this mean? It means that all the people, even in their 20s and 30s, are hurtling towards this apex, which is only going to increase the number. And quite possibly in the next 20, 30 years, this number will double, possibly even triple, depending on the experts that you speak about. So it's just something to give yourself a perspective on how we end up at the peak of this pyramid. And then these diseases of aging, as I call them, many of which are inflammatory in nature, include diabetes, cardiac disease. A lot of people have made the case that cardiac disease is really inflammatory in nature, cancer, osteoporosis, joint stiffness, digestive problems, arthritis. Notice that ITIS at the end, that's really reflecting and talking about inflammation itself, autoimmune disorders, Alzheimer's, and dementia. And again, all of which are inflammatory in nature. All or most of which are inflammatory in nature. So the Alzheimer's challenge. This is an interesting study that was done at Rush Hospital that when I had my office in Chicago, I would go by Rush on the freeway every day. And there was a researcher at Rush that back in 2014 looked at all of the death records. And because when you look at people that pass from Alzheimer's, the statistics might say it's 80,000 people a year. But when he looked at the death records, he found out when you look at actually what people pass away from Alzheimer's, is usually complications like cardiac and pulmonary disease or complications. And if you look at those numbers and put those into the factors of who is dying from what, you're getting about 500,000 people, which would make Alzheimer's the third leading cause of death in the U.S. Of course, there's COVID, and now that has changed and skewed the statistics. But over time, taking that out of the equation, that's where Alzheimer's would stand. So that's pretty significant. And another factor to think about is that about 13% of seniors over 75 live in nursing homes. However, which is a whole nother factor in terms of the economic impact of Alzheimer's, is that about 83% of all seniors with Alzheimer's are cared for by family members. So that's a whole piece in terms of how do we support those people and what resources do they have to prevent, stop, and even reverse the disease. And when I spoke at a summit and organized a summit around longevity last year, we looked at another phenomenon called aging in place, because about 65 to 70% of all people that are aging would rather age at home. It's called aging in place. So another piece of the puzzle is how do we support that population that would rather not move out of their homes? So that's a whole nother area of interest in terms of how we look at the impact. Now, I want to share part of my perspective in changing the trajectory of Alzheimer's disease, which is not just my term. What could be the impact if we did something that could change the outcome of Alzheimer's the way we are right now? And American Alzheimer's Association actually commissioned a think tank some years ago to look at the impact of how, if there was an intervention, this could change the outcome. And so they developed a paper called Changing the Trajectory of Alzheimer's Disease, a National Imperative. So I'm just going to share a few thoughts on that particular study. So cost of care for people with Alzheimer's disease. We're looking now, and you can see they started here in 2010. We're in 2023. We're looking at costs of care in terms of billions of dollars. But by 2050, we're over $1 trillion, $1.2 trillion. So one piece of the puzzle is just the cost in terms of the economic impact of Alzheimer's. And then they looked again at a number of people age 65 or over with Alzheimer's disease. We're looking at 5.2 million roughly right now, but by 2050, it's projected to be almost 14 million. And I think those numbers may be a bit low in the sense that with other things that we're looking at, like all of these diseases of aging, inflammatory processes, we're not maybe really factoring in all of that impact as well. And the general stress in the environment as well. So, but that's another way that they really charted this growth. And proportion of Americans age 65 or over with Alzheimer's disease by the stage of the disease. This is just interesting in terms of when you look at the pie chart on the left. In 2010, with current trajectory, severe is 41%. And if you look on the right with the current trajectory, severe is about 48%, a little bit more of an uptick. But why this is important, and we know this with COVID, is that when you're getting to the severe stage, people need more 24 care, around the clock care. And we saw with COVID what happens when you have maybe in the US 100,000 hospital beds that are available at any one time, with vacancy, if you will. But what happened during COVID? That was all overwhelmed. And COVID was a fairly short time frame. But Alzheimer's, when you look at the trajectory of Alzheimer's over 8 to 12 years, and I've expanded that to think of really what's going on, is that we're looking at a 20-year time frame from beginning to end with Alzheimer's, with other factors that are precursors to it. What happens if you have millions of people that need very concentrated long-term care. And that's why a lot of people think that the Medicare and Medicaid system might be bankrupt in 10 years if people don't have the resources to cover that. Who's going to cover that? Those are the economics of it. So they're projecting that at the current velocity, again, we're close to 14 million people that will have Alzheimer's by 2050. But they're also suggesting in this study, if there was a way to intervene in some way, we could actually stay pretty much at our current levels. And we would save 5.8 million people from contracting this disease, which is as many as we have now. So that's pretty significant. And that's just their own projection and their commission that they studied to do this research. So impact of a 5-year delay, we're just talking about a 5-year delay in the onset of Alzheimer's, not even doing anything to stop it completely, even reverse it, just delaying the onset. They actually found that by 2050, if we had a way to do this, we would, and again, I mislabeled this, it's not million, it's billions. So we would save nearly $500 billion by 2050 if we could find a way to intervene in this situation. All right, so that's just a little bit of a perspective I wanted to share with you on the economics of Alzheimer's and what's going on. All right, now cranial sacral therapy, what is it? And using our research on cranial sacral therapy as an example of what an adjunctive treatment might be, which is complementary to the medical model. Here's a little idea of this, is that what we're doing with a manual therapy technique, we call it a very gentle light touch, is that kind of the medical and pharmaceutical perspective is to treat the symptoms, if you will. And from our osteopathic, which cranial sacral therapy is derived from osteopathy, we're not just looking at the symptoms, but we're looking for the generator of the disease process, always inquiring to see what is generating. So in a way, it's a little bit like one would do classic research anyway, but we're doing it even with our hands, feeling into the body, telling us what the history of the body has to say about the situation. And my mentor, Dr. John UpLedger, developed the modern form of cranial sacral therapy in the mid-1970s. And to date, we've taught over 100,000 practitioners worldwide in the last 30 years. And as I mentioned, we have trained, we've set up affiliates in 57 plus countries around the world. So this is something that's become even more of a known modality. And what did Dr. UpLedger find? He discovered and documented the existence of what's called the cranial sacral system that conducts cerebral spinal fluid in the head and down the spine to the sacrum. So a lot of people, when they hear the word cranial sacral therapy, they think, oh, is this something just having to do with the head? But indeed, when you look at the head, down the spine to the sacrum, close to the tailbone's at the very tip, and then the spinal column in between, that's why we call it cranial sacral therapy, from the head to the tail, so to speak, in the sacrum, and the spinal column in between. And what's key is that we're following the flow of cerebral spinal fluid up and down the spine and in the head. And we know the cranial sacral therapy can help combat things like memory problems. And we know this from our therapeutic experience because we've seen that cranial sacral therapy can help increase the volume of cerebral spinal fluid. It can help enhance immune and endocrine system function. And also in the body itself, it can help increase overall connective tissue fluid flow in the body. It can assist with neurological balance and also assist with even the emotional component as well with people that are trained in that area. And it can help with what we call completion with the past. And this is something of more of an advanced way of thinking about it. But as we know with people with memory problems, sometimes it just seems like they don't want to remember what's ever occurred in the past. So it's very interesting that if there were a way for the body to be complete in some way, shape, or form, it could give a lot of relief to the patient. So we're kind of broadening the envelope to think about that aspect as well. So first of all, let me talk a little bit about prevention, because I think for everyone, they would rather prevent a negative outcome than deal with something that's there. So I want to talk about that for a minute. Given this background, for many parts of aging in the healthy population, we could have a focus on prevention. And so let me talk about that. When we train therapists and when we look at what's common with aging in terms of things that become more problematic as we get older, they include things like challenges to bones, losing bone mass, vision. That can be a big one. Hearing and balance. That's important because as we get older and we lose balance, that can mean that things kind of go downhill. And that means that people lose their mobility. So that one's very important. Immune system challenges, the thoracic area in terms of the heart and lungs, the digestive, which is very, very key, and cognition and memory. So part of what we do in training therapists is to look at all these aspects in a more in a broadened perspective. So CST, why is CST the missing piece, shall we say, in Alzheimer's care? Well, we've changed our perspective over the years, and I just alluded to this. The perspective in general in the field is there's no known cure. And the idea is that Alzheimer's is not preventable. And to the changing of our perspective, that Alzheimer's is indeed preventable as well. And American Alzheimer's Association, if I may, is even saying now that, that it's possible if we do certain things, we can actually prevent the onset of this disease. So that's a different change in perspective as we look at this. And I'm starting to say, when I'm looking at what we've done and working with people with manual therapy, is we could actually slow the progression of the disease. And remember that chart I showed you that American Alzheimer's Association did in terms of if there was something that could be done, what would the impact be? They're saying, which is significant, that even if we could slow the progression by 5 years, just in terms of economics, it could save billions and billions of dollars. So that's just kind of an interesting change in perspective of how we've looked at disease progression. If you listen to Dale Bredesen, who I did a talk with and a panel a few nights ago, he even says, well, there isn't any reason that Alzheimer's could be completely preventable with enough intervention, maybe a thing of the past. So that's a real change, even from the last 10 or 20 years in terms of our perspective in looking at this particular disease process. So our perspective is that not only can we slow the progression, but we can perhaps stop the progression altogether. And even with enough therapy and enough intervention, perhaps even reverse the process. And as I mentioned down here, Dale Bredesen, Mark Hyman, Dale Perlmutter, they're all speaking about this in terms of what's possibility, in terms of what could be possible as far as a change. So that's interesting. So our approach involves examining causative factors, including diet and exercise and environmental factors and structural and neurological influences. So it's important to know that there may be one or more things that contribute to memory loss and cognitive challenges. And diet's important, key. When I talk about our perspective, the body energy longevity prescription, we're saying other things are complementary to helping protect people. One of them is, and there's many different types of diets, and I'm sure you've heard this in this particular summit and perspective, many different approaches to diet, many different approaches to exercise. There's environmental factors, and again, even structural and neurological factors, which we speak a lot about in cranial sacral therapy. But generically, the idea that if we can approach diet differently, that's an important factor. Exercise, all of these factors and building blocks are key to look at. And so a complementary model to nutrition and exercise-based approaches. And this is really key to understanding why we talk about the missing piece. A majority of these diseases of aging that I mentioned and other factors are really metabolic in nature. And changes in diet and exercise can have a profound effect on prevention and even reversal. However, these metabolic channels can be blocked due to past and current insults to multiple anatomical systems over time. So put simply, it means that even when we have changes in diet, even when we do things that are complementary to cranial sacral therapy, if we don't free up the structural piece, and even in a micro level that I'll talk more about in a minute, of neurological factors in the brain and the body won't be able to take advantage of some of these interventions. The body won't be able to absorb nutrients. So whether someone's currently diagnosed with Alzheimer's or want to prevent it, all these are factors that are important in terms of looking at this approach. And so this means, again, especially in regard to neurological systems in the brain, that improvements brought about by changes in diet and exercise may be slowed or blocked without clearing prior restrictions in the central nervous system. So we feel that cranial sacral therapy is a way to complement and accelerate the results of these other approaches, and often in a way that even offers more immediate results and opens the door to these other approaches as well. So we can look at some of the 5 major influences of Alzheimer's, because as Dale Bredesen said, Alzheimer's is not just a one-pill solution. So that's why somebody can have a diagnosis of Alzheimer's, but there can be many, many different ways they get there. So one thing can be, for example, is inflammation. This can be associated to a very great degree with diet. So that's a piece of it. The body, simply the foods that the body imbibes, especially if there's a concentration of sugar, for example, and many people have spoken about that, that can cause an inflammatory response in the body. And it can actually raise insulin resistance, which means there's less oxygenation in the brain. We can't absorb the nutrients, causes other problems in the brain as well. I'll talk about even more depth in a minute about that. Atoxic. There can be hormonal imbalances, which can cause problems. There can be toxic. There can be an imbalance. Maybe there's more mercury in the system somehow, trace amounts, maybe more aluminum. I remember when I grew up in the 50s and we were eating these Swanson TV dinners, and even I in the 50s as a kid was thinking, you know what? Well, I wonder if that's good if you eat a lot of aluminum. It was a joke at the time, and people weren't talking about Alzheimer's so much per se. They were talking about people becoming more senile. But it's the idea, yeah, that if there's more toxicity in the body, that can be problematic if that's not cleared. And then again, there's stroke, there's vascular, that can be stroke or heart attack. And finally, external trauma. So this can be blows to the head. This can be situations where there's closed-head injury, there's car accidents. And part of the study that we did with Cranial Sacral some years ago, and where this is kind of ongoing, is working with NFL players, because we realized that when NFL players have assaults to the body, sometimes you look at their brain scans by the time they're 40 years old, and they look more like people that have Alzheimer's. So there can be external trauma as well. And why this is important when you're looking at the analysis is that, again, not one size fits all, which is maybe why it's more challenging for any drugs to be developed to treat this, because it's multifactorial. So some people, half the battle might be 50% of their body is reacting to inflammation, another 40% to trauma, another 10% to vascular. And it could be any combination of these. And if you listen carefully with your hands, you can find out, and as well as there's testing to find out about the factors as well that can do this, blood test. But when you look from a manual therapy point of view, you can actually feel in the body and get a sense of what is more predominant. So that's why we're looking and honoring people in a more individual way when we're talking about what may be a factor that influences their health. And so our model for non-pharmaceutical invention includes two key factors, which leads to Alzheimer's. One is neuroinflammation in the brain, and the other is lack of flow of cerebral spinal fluid. And as you see here on the left, here's a healthy brain. It looks kind of, like pretty plump and healthy. But look on the right, with Alzheimer's, advanced Alzheimer's, what we found is there's decreased flow of cerebral spinal fluid. And it's as if it's as if the brain dries up. It shrivels up. And that's because there's lack of flow of cerebral spinal fluid. It would be great if we could just put some type of a potion on our head and irrigate the brain, but that's not really the most effective way. But we can treat people how to use this very, very gentle manual technique to increase this flow of cerebral spinal fluid. So our proposed ecological model in etiology is the study of causes again, is that the flow of CSF or cerebral spinal fluid in the brain is significantly correlated with the progression of Alzheimer's disease, and inflammation in the brain also contributes to this decreased flow of CSF. And I want to show you here just a little illustration. This is from YouTube. Notice here in the center, this is called the choreplexes and the ventricles of the brain. And we see here this flow extending out. There's the cerebellum at the bottom, and then we see the periphery of the what's called this meningeal system that surrounds the brain. And it's really the idea that what we're doing here, I'll play this again, is mapping the flow of CSF as it bathes the brain. I'm going to come back here to this one slide in just a second. Sorry. Play this again. So just notice this flow. In classic cranial sacral therapy, as we've been approaching it with Dr. UpLedger for years, has looked at this flow and seeing how we can, even when we can, through gentle manual techniques, include and expand this flow of fluid inside the brain. And here's a little close-up anatomically of this. If you see here, this is bone, that gray part. And the key thing I want to point out is this part that's in the orange here, and all these little structures that look like little spider webs. Okay, this is called the subarachnoid space. And this is a key area that we talk about in terms of cranial sacral therapy, because that's where the cerebral spinal fluid flows. So this is a structure we've been familiar with for many, many years. What I want to point out in the next slide, though, is some research, and I'll come back to this again, that's just really come out since January of this year from University of Rochester. And what they have found is right in the middle. I don't know if you can see my pointer here, but imagine if you can't see my pointer, that right in the middle of the subarachnoid space is a layer only a few molecules thick. And it's as if it's a barrier that protects immune system factors that are inappropriate from flowing into the brain. And what I'm referring to is the following, that you see they're drawing here from University of Rochester. This green structure here that looks like a little bit like a forest, this is a new structure called the SLYM. It's only a few molecules thick. And it's called the subarachnoidal-like membrane system. And the thinking is that what the job of this system is to help monitor cerebral spinal fluid for signs of infection and inflammation. And if inflammation crosses this blood-brain barrier, that can cause further problems. This is something that wasn't known before, and part of our model of progressive brain inflammation, excuse me, that I've been talking about for years, really fits into this structure that no one knew existed right in the center of the subarachnoid space. So I just thought I'd mention that as some of the new research. Now, new advances in the discovery of the glymphatic system sheds further light on this matter. So besides the idea that there's just flow of cerebral spinal fluid in the periphery of the brain, researchers, again, from University of Rochester have helped define, especially in the last 10 years, even getting a Nobel Prize for some of the research on this and imaging, that there's a whole system in the body called the glymphatic system, that it was known that something was happening in the flow of cerebrospinal fluid that was effective, but no one knew exactly how and why it was as effective as it was. And glymph means glue, lymphatic means lymphatic system and flow in the body. But this is talking about an entire structure in the brain. And when you think about this glymphatic system, it's composed of about 100 billion neurons and 100 billion astrocytes or glial cells, and about 1,000 kilometers or 400 miles of blood flow in the brain. So you can think of this as a microstructure. This is a very intricate structure in the brain. And when we look at the periphery, the blue up here, if you can imagine there was a way, if there could, for little portals to penetrate into every nook and cranny of the brain, then that could be very important in terms of a connection between the outer part of the brain and the flow of cerebrospinal fluid, and this flow internally. And I'm going to play here for you about a 3-minute video from University of Rochester about some of the research that they've done on the glymphatic system, and also, interestingly enough, how this relates to Alzheimer's dementia. So we'll play that now.
The brain's highly metabolic reactive. The brain cares an awful lot about what its environment is like. If it's off just a little tiny bit, it stops functioning properly. We showed that the CSF goes into the brain just like people thought before, but it actually does so along very specific anatomical structures. There's a specialized anatomy that allows the CSF to move very quickly and very deep into the brain, exchanging with the fluid that's inside the brain and then moving out. So it's a much more efficient system for clearing the fluid and the waste out of the brain. We injected fluorescent tracer into the CSF, or the fluid that surrounds the brain, and watched to see where it went. The fluid, as it moves down the artery, is able to move right into the brain tissue. As it moves into the brain tissue, eventually, if you look long enough, where it collects is at the other end, at veins, which are the other part of the circulation. Once it reaches those veins, it's able to drain out of the brain along the outside of the veins. As the fluid sort of courses between those two, in along the arteries, through the tissue, out along the veins, that continuous flow sweeps along particles that are sitting in between the cells. Amyloid beta is a protein that is made and secreted from cells in your brain all the time. In Alzheimer's disease, one of the things that happens is amyloid beta builds up in the brain and clogs up the space in between the cells. And it's thought that that's what kills the neurons and causes the dementia that's the hallmark of Alzheimer's disease. So when we first found the system and found that it was clearing extracellular solutes, we said, well, what solutes might be of interest that might be being cleared by this? And when you think about extracellular solutes that the brain wants to get rid of and needs to get rid of, the first thing that comes to almost everyone's mind is amyloid beta. So that was pretty much the first thing we tried, was to find out whether amyloid beta that's between the cells is cleared along this pathway. One thing that could be happening in Alzheimer's disease is this pathway is failing. So if because you're aging, this pathway stops working properly, or if because you suffer an injury or an infection at some point in your life, maybe this pathway stops working properly, and that ends up causing the deposition and the accumulation of amyloid. For treatment, it suggests that you could slow the process of amyloid deposition, perhaps by speeding the system up and sort of flushing the brain out and getting rid of the amyloid before it accumulates. And if you had, a brain that had a bunch of amyloid that had already accumulated in it, perhaps you might be able to flush that away or wear away those accumulations with, a higher rate of flow. So we may be able to try to modulate or change how this system functions to try to clear it more quickly.
So that's I found this to be kind of an interesting perspective. And one of my associates, Ted Van Veer, who's also teaches for UpLedger, provided this drawing for me. because what he's talking about, if you notice the animation in this video, is this is a close-up of a very, very refined structure in the brain in the glial system called the neurovascular unit. So this is a micro view of the glymphatic system inside the brain. This is on the level of 20 to 40 nanometers, like 25 million of these an inch. So it's very, very small. So we can look at the structure and look at a few things. This blue here, the light blue, represents the astrocytes or glial cells. And notice here at the top and around the bottom, these little infeet, they're called infeet, and they like to, and imagine this illustration was in 3 dimensions. So you could look at it from that perspective, a 3-dimensional model. Notice that the infeet kind of snuggle against each other. They also snuggle against these green, these are the neurons, there's about 100 billion of those. And then also they snuggle against the capillary system, which there's 400 miles of a network inside the brain. So they're constantly surrounding in a network, this whole structure. And the light yellow on my illustration, these are these channels, pathways that Professor Illich was talking about inside the brain. This is called the paravascular space.